Home is a place where most of us feel completely safe and comfortable. For some elders, however, home is not a safe refuge. Behind closed doors, these older people are victims in the tragic drama of elder abuse. Elder abuse is the mistreatment of an older person by someone who has a relationship with the elder. It could be a spouse, adult child, friend, neighbor, or caregiver. According to the National Center on Elder Abuse, more than 2/3 of the abusers are family members. Elder abuse can happen to anyone, by anyone, regardless of his or her social class or ethnic background. The results of elder abuse can be seen in the unnecessary suffering, injury, and violation of human rights of the elderly. Hello, I'm Marian Karpinski, and I'll be your host during this program. Elder abuse can happen anywhere. It can happen in group homes, such as foster homes, nursing homes, or assisted living facilities. In this program, we will address elder abuse in the elder's family home. Elder abuse can be difficult to identify. Some diseases and chronic illnesses can mask or mimic the visible signs of abuse. For instance, some diseases may cause people to bruise more easily. Weight loss may be a symptom of a disease, a caregiver's failure to provide adequate meals, or an elder who refuses to eat nutritious meals. Elder abuse is very complex. Generally, a combination of factors contribute to elder mistreatment. Abuse is often inflicted in a subtle way, especially if it's premeditated and deliberate. Abuse can be the result of a history of family violence that continues into the person's later years, or violence that begins with a new relationship, such as marriage. Violence is a learned behavior that in some families is passed on from one generation to the next. In these families, abusive behavior is their normal response to life because they have not learned other more appropriate ways to respond.
Talking about the learned behavior and the learned violence, I think that it's very important to understand that we all grow up learning how to behave in a family from the family we grew up in. And if corporal punishment and if verbal abuse is part of a person's upbringing and they come up having that be the norm, I think it follows through and translates into older age that the child who was verbally abused is now going to use that same verbal abuse on the elderly mom or dad who is now bedridden or wheelchair ridden, and think nothing of it because that's how it's done in this family. Unfortunately, I think that it then escalates because the response from the elder is usually nothing or very little because of their fear of making a bad situation worse. And so the frustration coupled with the learned behavior is a recipe for it getting worse. We know abuse gets worse. It does not get better.
Elder abuse may happen because the abuser suffers from mental illness or from problems such as alcoholism, drug addiction, and financial difficulty that makes him or her dependent on the elder for support.
If there's an abuser who tends to use drugs and alcohol, what we know is that can give them, first of all, the permission to go through with the abuse, and secondly, it will accelerate it to possibly make it more dangerous and greater than it could have been.
Another contributing factor that results in elder abuse is caregiver stress. Not all stressed caregivers are abusers. For some people, the demands of caring for a frail older person, the absence of financial resources and support, and the lack of caregiving skills may lead to abuse or neglect. Without meaning to, a caregiver who lacks proper training can cause bruises, skin tears, and broken bones in the process of moving and positioning an elder.
One of the most common things that we see in elder abuse is sometimes what we misconstrue as caregiver stress, when truly what it is a continuation of family violence, domestic violence, that has probably happened in that relationship for a very long time. And now here we are as family members or healthcare providers, and we have a spouse who's coming to us and saying, you know, it's so frustrating to be the caregiver here because it's just so stressful, and I just am at my wit's end half of the time. And if we say to that person, well, I understand how it is, I really do, it's a very stressful situation, and we are somewhat giving permission for that to continue. We're justifying the abuse because of the caregiver's stress.
Ageism is a form of prejudice against older people based upon negative images and stereotypes. Ageism increases the risk of elder abuse. The abuser uses these prejudiced attitudes to justify mistreatment of an elder. The definition of elder abuse varies from state to state, but it is generally agreed that the forms of elder abuse include physical abuse, sexual abuse, emotional or psychological abuse, financial exploitation, neglect, self-neglect, and abandonment. It is important to know what signs and symptoms to look for in identifying each form of abuse, because the abuse is often well hidden by the victim and the abuser. According to most state statistics, neglect is a leading form of elder abuse. Neglect typically means the refusal or failure to provide the necessary care to an elder by someone who has assumed that responsibility. It includes the refusal or failure to provide an elder with life necessities such as food, water, shelter, clothing, personal hygiene, medicine, and personal safety.
What caregivers need to remember is that if they are assuming the role of a caregiver, and this could be a paid position or an unpaid position, that they have a certain level, a certain duty to perform their activities with the older person, which in many instances is a family member. I would urge people to understand that the states are becoming more proactive now when they're dealing with neglect situations. And in some instances, a neglect situation of an elder person, failure to provide food, not turning the person in a bed, which could result in, say, bed sores or decubitus ulcers, could rise to a criminal level. And in many states, there are prosecutions taking place now on this specific form of elder abuse.
Some of the signs and symptoms of neglect include unsanitary living conditions, such as a dirty home, fleas, the smell of fecal and urine odors, soiled linens, or lice on the elder's body. Other signs include untreated bed sores, poor personal hygiene, dehydration, and malnourishment. Unsafe living conditions, such as no running water or heat, are signs of neglect. Neglect can also include the failure to pay for home care services by a person who has financial responsibilities to provide care for an elder.
Self-neglect is another form of neglect, and this is when an elder person who's taking care of themselves does so at a risk to their health and well-being. Now, for instance, an elder person may not be feeding themselves enough, may not be hydrating, taking enough medicine, or taking too much medicine. What about their general living conditions? They may be living in a very dirty environment. And this is another form of neglect that we need to be very cognizant about.
Unintentional neglect may occur when the person assuming responsibility for care is incapable of providing that care.
When I first came here, I realized that my stepfather had dementia and he was getting worse. And my mother has had a problem with her knee and her hip, which turned out to be her heart and her lungs. And my mother could no longer care for my stepfather. And my stepfather could not care for my mother. They both needed care. They both needed help. And we didn't know where to turn at that point.
Financial exploitation is a very serious issue as it relates to elder abuse, because as people age, they need to keep their monies for taking care of themselves, providing food and shelter, and also medicine. And there are some people out there that are intentionally trying to rip off seniors, whether they're friends, caregivers, or even fraud scam artists. And some things to be mindful about when you're dealing with financial exploitations. Who's got the check writing authority? Is it the senior citizen, or is it perhaps a caregiver that has been able to get their name on the bank registry? What about other legal documents, power of attorney, the sale of property or deeds or trusts are issues to look at as well.
Look for sudden changes in bank accounts or unusual banking practices, such as a withdrawal of a large sum of money. You may want to check the elder's bank signature card. This will alert you to any additional names that may have been added. There may be an unexplained disappearance of jewelry or personal property. The elder may complain of missing articles or money. Caregivers or family members may gain unauthorized access to the elder's ATM card and withdraw money from the elder's account without his or her knowledge. The elder who is bed or wheelchair bound or who has dementia is more vulnerable to this type of financial exploitation.
And also seniors are vulnerable to the regular scam artist, the door-to-door salesperson, for instance, who wants to sell a new roof, or the telemarketing person that intentionally targets the senior citizen because of their trusting nature and perhaps the availability of funds which they may have.
Emotional and psychological abuse really is one and the same thing. It is when an elderly person is being spoken to in a derogatory manner, is being told that they are stupid, that they don't know what they're doing, that they are a bother, when the person who is giving care to them withholds things that they need like medication, clean clothing, clean bedding, affection, food, attention. When the elderly person is made to feel as though they don't count, that their needs are not important, and that they are in the way. We find that often emotional and psychological abuse, verbal abuse, can be more damaging over a longer period of time than physical abuse can be. And we have found that to be so. And it drives the person who is being abused inward, which is what keeps them isolated and keeps them from getting help and encourages the abuse to continue.
Physical abuse is defined as the use of physical force that may result in bodily injury, physical pain, or impairment. Hitting with the hand or an object is only one form of physical abuse. Pulling hair, pushing, shaking, kicking, pinching, and burning include other forms of physical abuse.
There was one time when I walked in the room and he had raised his hand, backhand, to my son. And my son is 4 years old. And my son was like this with his hands up against his face in fear of what my stepdad was going to do to my son. And of course I stepped in and stopped that. But what was so sad was the dementia had made him very unpredictable. And at one point when he had had a stroke, the nurses had even told my mother to hide the knives. He had taken knives to some of the portraits that he had done of my mother.
Force feeding, inappropriate use of drugs, and physical restraints are other examples of physical abuse. The signs and symptoms of physical abuse may be bruising or finger mark bruising on the arms or legs. Black eyes, welts, and rope marks are other signs of physical abuse. Broken bones, sprains, dislocations, open wounds, cuts, or punctures may indicate physical violence against an elder. It is important to look for signs and symptoms of abuse in areas that are not as readily visible as the face and arm, such as the stomach and back. Some abusers deliberately choose those places to hide the abuse.
Sexual abuse is a kind of abuse that we overlook in elderly people often because it is particularly shameful to them, so they don't reveal it to us as often. But sex abuse in elderly can include things like unwanted sexual contact, sex without being able to give consent, as in the Alzheimer's patient or disabled person, forced intercourse, any kind of sexually degrading acts that are against the person's moral belief. We see these things more commonly than we want to believe.
Of all the abuse, the sexual abuse of elders is something that they are very reluctant to talk about. Oftentimes, elderly women do not think that when a male child or grandchild or caregiver says something inappropriate to them that is sexually inappropriate, that there's anything wrong with it, because they come from a time and a belief system where men were given the right to speak to women in certain ways, and they don't think there's anything off color or wrong about it. But often that leads to further abusive situations. I think that it's very difficult unless there are outward signs like the obvious vaginal infections or bruising in the area or what have you, that a person really can tell when there is sexual abuse, unless the person who is being abused begins to give you clues. Oh, well, they want to always be in the room when I'm changing my clothes, or he insists on coming in the bathroom and staying there, and I ask him to leave, but he stays, and those sorts of things. Little clues that we need to be so aware of and pick up on and begin to ask more about.
Other signs of sexual abuse may be a change in behavior. For example, an elder who becomes severely upset when being bathed, dressed, or undressed. Torn, stained, or bloody underclothing, or unexplained vaginal or anal bleeding may also be signs of sexual abuse.
Deserting an elder person by a person who has assumed a level of care or duty of responsibility is called abandonment, and that's another form of elder abuse. A famous case that took place several years ago was when a caregiver, a family member, took their father to a neighboring state. This individual had Alzheimer's and was confined to a wheelchair. The caregiver put this father at a racetrack and abandoned the person with no intention of ever coming back. We see abandonment cases with a little bit more frequency now. Oftentimes the person is abandoned at a hospital or senior center or abandoned at a shopping mall by a caregiver with no intention whatsoever of ever coming back to get this person.
There are some general signs that may indicate abuse is occurring. For instance, the elderly person may complain of being mistreated. Watch for any sudden change in the older person's behavior. For example, a once very talkative person may suddenly become withdrawn and depressed.
The person who is being abused often is very reluctant to talk, is very shy and withdrawn. Upon inquiring if everything is okay in the household, will always say quickly, everything's fine, everything's just fine. When you begin to suspect that something might be wrong and you begin to push a little further, you will often notice that the abuser is in the other room listening to what is being said by the abused person, and as a result, the next visit you make will often find a reason for you not to come into the home. The closer you get to an abusive situation, the more there is to protect on the part of the abuser, and the abused person is more fearful than ever, and you will notice more and more agitation on their part because of their fear.
Abusers come in all shapes and sizes. No single characteristic identifies an abuser. An abuser uses whatever means possible to deflect attention away from the abuse. An abuser may be
someone who was unwilling or would be finding excuses for the home health nurse, for instance, to come into the house, would be making excuses for why this person can't be there. They're asleep, or they're having a bath right now, or they're at the doctor, or they're at the dentist, or they don't want to see you today. You would find normally that this person is very short and doesn't want to engage in any kind of a lengthy conversation with you. Often will speak out the window or with the door just slightly ajar. They do not want to be confronted because they have something to protect.
Sometimes it's very hard to identify someone as an abuser. And the reason is because they're often very charming. People really like them. They have a good sense of humor. And they're often leaders in the community. Maybe he had a Boy Scout troop at one time, leader in his church. Very convincing. An abuser is someone whose life depends upon their good manipulation, their good charisma with other people. And of course, behind closed doors, we know that there is an entirely different story here. First of all, we all need to get better educated. We need to understand the dynamics. We need to understand the resources in our community. We need to know what to do and to know all the warning signs. So that would be the first thing, is to really raise our own personal awareness. I think then as healthcare providers, another very important thing for us to do is to do some very good screening. When we ask the question, we will get an answer. When we ask about past abuse and present abuse, we'll get some insight into what is going on with this person and how their health is affected. And to do proper screening, we have to be very careful about this, very sensitive to the situation. In other words, you must provide that patient a time alone. And this could be the policy of your home health care or your hospital or facility, that every patient has that private time with his or her healthcare provider. So you can ask those questions in a way that makes it safe for them to say, yes, I am being abused.
Listen and take seriously any complaints of mistreatment from an elder. Here are some things to keep in mind if an elder confides in you about an abusive situation. Do not bombard them with questions or interrupt with comments. This may be a very difficult subject for the person to express. Do not jump to conclusions or make accusations. Always respond openly, honestly, and with sensitivity to the elder. Any complaints of abuse from an elder should be reported to the proper authorities. One of the ways we can help prevent elder abuse is to provide family caregivers with education and training in proper caregiving procedures. Families also need support and respite services. We all have a responsibility to help prevent elder abuse, and one of the most important ways to do that is to report it. Most victims do not report abuse because of their shame, denial, fear, and isolation. They may be unable to report abuse because of physical disabilities or because of dementia, such as Alzheimer's. It is very important that we make the report of suspected abuse on their behalf. If the elder is in immediate danger, call 911 to make the report. Most states will take a complaint of suspected abuse anonymously. If danger is not immediate, you can report suspected abuse to your local county Adult Protective Services, whose professional staff will make the investigation.
Adult Protective Services was there within an hour to counsel with us, to tell us what our options were. They heard that we wanted our stepfather to be cared for as well. And what was so great about it was it ended up where my stepfather got the help that he needed and deserved, and my mother is cared for and has dignity, and there's peace in our home.
If you have difficulty finding your local Adult Protective Services number, you can call the National Elder Care Locator number at 1-800-677-1116, and let them know you want to report suspected abuse. They will let you know the number to call in your area. Many states have mandatory reporting laws for professionals who work with the elderly. If you are a mandatory reporter, and most health professionals are, follow your state guidelines for the proper procedure when reporting suspected elder abuse. The drama of elder abuse need not end in tragedy. When you become an elder's advocate, you break the cycle of isolation and secrecy that is at the heart of elder abuse. You may be the one person who can make a difference. Your involvement may be the key to restoring peace and safety to an elder's life. Use the resources available in your community to report suspected elder abuse.